spine surgeons come from a specialty of neuroscience as well as orthopedics. Tell me more about that. Do they overlap?
Neurosurgeons generally don't do fellowships, which means that the 5 years of training was dedicated to spine somewhat, whoever was the dedicated spine guy in that department, and then they do brains the rest of the time, which is a whole different world. Orthopedic surgeons become spine surgeons only if they do a fellowship, which means dedicated time with a high-level spine surgeon that has been approved by the American College to educate fellows. So there is definitely a difference between orthopedic surgeons and orthopedic spine surgeons and neurosurgeons, but it is not any more characteristic as a difference between one neurosurgeon and another. Because at Duke, for example, ortho and neuro work together. So I actually worked with like 14 different spine surgeons who were either ortho or neuro, who were doing the same things differently, and I was able to pick and choose things that I like. Whereas other programs may be only ortho, only neuro. There is even a push to create a spine-only residency that focuses on spine exclusively, because human spine is so different really than brains or the rest of the extremities. I would say whether a doctor is an ortho or neuro should be denigrated to a lower level of importance, just like whether the doctor is an MD like myself or a DO. In the end, what makes a difference is one, does the doctor do the most modern, well-tested procedure for your problem? Number two, does that surgeon have good reviews? Meaning that when patients have bad outcomes, does he abandon those patients, which will usually result in a bad review, or does he see them through until they are recovered and back to good? And then you want to look at whether the guy or a gal has a lot of lawsuits and judgments against them, because you may not get everything you need from just looking at the reviews. I'd say those are the most important things to find the right doc. Ortho, neuro, it doesn't matter. Look them in the eyes and ask them, how many procedures like this have you done? How many complications have you had? And what did you do about those complications? And within the response, you will see whether this is a kind of a person you want to entrust with your well-being.
Got you.